Esophageal cancer with acid reflux. Now, this question comes up a lot, so I thought I'd just make a complete video on it and try to explain the cancer physiology and the things that you need to watch out for. Unfortunately, it's becoming more prominent, I'm guessing because of the lifestyle issues and stuff. But anyways, without wasting any more time, let's quickly take a look at how it works. But before we get into the cancer physiology, let's understand how acid reflux works at the very base level. Why? Because we've already put out the video with great detail on that topic as well. So if you guys need to know more about acid reflux, you can check that video out. But anyways, if you look at this stomach, you have gastric juices in the stomach, and it's full of hydrochloric acid, okay, which is, by the name of it, it's very acidic. It's okay if it stays inside of your stomach because your stomach has this green protective lining that protects its own tissue from the acid. Otherwise, it'll just eat away. Now, that happens in certain conditions such as peptic ulcer disease, gastritis, but we're not gonna get into those details right now. We're gonna focus on acid reflux. However, if you look at your esophagus, it does not have that protective lining. So if for whatever reason this acid decides to go back up into your esophagus, it can start to damage the esophagus or esophageal lining and bring about a lot of the inflammation. Now, if that happens, say a couple times, few times, and you go see the doctor, you get the medication, you avoid the triggers, you get better at it, right? You get better, you recover from it, no problem. But if it continuously stays there, this process of acid reflux, if it's chronic over the years, months and years, and goes unnoticed, or you don't really seek medical attention or make lifestyle changes, that's when it starts to become the problem. Now, to understand that part, let's take a look at this set of cells. Now, these are the normal cells of your esophagus. You see how they're layered one on top of the other? They're called stratified squamous cells. Problem with these cells is they're not capable of dealing with the stress that comes with hydrochloric acid in people with acid reflux, okay? So what they need to do with chronic acid reflux, they have to undergo a structural and functional change, and they can turn into special type of cells called columnar cells. And you may ask why that happens. It's because these cells have the ability to deal with the stress that comes with acid reflux, I should say. And this is the stage what's usually referred to as Barrett's esophagus. You might have heard of people saying they went to the doctors, they've had acid reflux for years, and they got it checked out, and it turned out that they had Barrett's esophagus because these cells are being replaced by new columnar cells, okay, to be able to deal with that stress. And that's what's referred to as Barrett's esophagus or metaplasia. Now, it doesn't really take a whole lot of damage on these cells for them to become dysplastic. What do I mean when I say dysplastic? These cells, with any sort of mutation, with all that stress, can turn into cancer cells, which is what's referred to as adenocarcinoma in this case. And that's the basic physiology of adenocarcinoma, or the esophageal cancer related to acid reflux. There's another different type of esophageal cancer, but we're not going to talk about that in this video because we're mainly concerned about acid reflux. So this is the one that you get with acid reflux. So now the question becomes, how do you know if you have this cancer, right? Especially if you've had acid reflux or chronic acid reflux over the years, you may be worried whether or not you have this issue. Now, usually this type of cancer is asymptomatic, but if it does present with the symptoms, they will be such as difficulty swallowing food. Now, how does that work? Think about it this way. If you have a tumor sitting right here in your esophagus, right here, what you're basically doing is you're narrowing the lumen of your esophagus, meaning there's not enough room for your food to pass through, right? And that's when people complain every time they eat food and they have a hard time swallowing it. That's where it becomes a problem. However, I do want to mention that this does not automatically mean that you have adenocarcinoma or the esophageal cancer. Why? Because this could be related to multiple other issues. But since we're talking about acid reflux, in this case, because the acid goes into your esophagus, it can promote a lot of the inflammation in that area, okay? When you have a lot of the inflammation, it can bring about a lot of the inflammatory fluids and form edematous tissue. which also does the same thing. It swells the tissue and makes it harder for you to be able to swallow the food. Okay? That could also be one of the issues. That does not automatically mean, just because you're having a hard time swallowing food, does not automatically mean you have esophageal cancer. But it is very important for you to check with your doctor in this case. The whole point of this video is to explain all this information to you guys, so you guys are more aware of the symptoms, or alarming symptoms, I should say, and know when to seek medical attention immediately. Second symptom that it can present with is GI bleed. Okay? When I say GI bleed, the blood needs to move from here, from upper GI tract, all the way through your stomach and through your intestine into your poop. So it takes time, it gets oxidized, gets dark, so you'll have dark bloody stools. And then the other way it can come out, obviously, is vomiting. You may vomit out blood, because if this is a tumor, it can start to bleed, and then you may see blood in your vomit, also referred to as hematemesis. But again, this does not automatically mean that it has to be an esophageal cancer. So it's very important that you check with your doctor. And the third, I would say the most important symptom that you guys need to watch out for, especially if you've had acid reflux for years and years, is you having to cough right after you eat. So every time you eat food, you're having to cough. And the reason why that happens is because this tumor sometimes can gain the ability to make a little passage into your lungs. We call it fistulas, but you can think of it as a tunnel. So if you have that tunnel going into your lungs from your esophagus, every time you eat food, it's going to enter into your lungs as well. And it irritates the lungs, make you cough all the time right after you eat the food. So that's one of the symptoms that you guys really need to keep your eye on, especially if you've had the history of acid reflux for a long period of time. And that's pretty much everything you guys need to know about the esophageal cancer related to acid reflux. And if you have any more questions, leave them in the comments below. I'll try to answer as many of them as I possibly can. And thank you very much for watching the video, and I'll see you in the next one.